Now more close about the skull and its structure. Skull is divided, or we divided, to the calvaria or roof of skull, composed of several bones, and basis of skull. Basis of skull including external and internal. The neurocranium, that includes roof of skull and facial skull partially, is represented by many bones, like frontal bone, that is here, frontal bone, occipital bone, ethmoid bone, sphenoid, temporal, and parietal. So 6 types of bones, but of them temporal bones and parietal bones are paired. So the bones of neurocranium in total are 8. Most of them are of the membranaceous or endochondral origin, means they undergo only 2 stages of development, like part of frontal bone, like a squama or blunt part of occipital bone and parietal bones. They are flat bones. While temporal bone, especially exactly the pyramid of the temporal bone and the sphenoid bone, they undergo 3 stages of development. So they have cartilage as the second stage. The temporal bone is quite an intricate type of bone, consisting of different portions and having very many canals inside for passage of nerves, arteries, and veins. Also, the part called the mastoid process has the spaces inside called cellulae, where the air is present. Then facial skull is represented mostly of flat bones, like partially frontal bone, then lacrimal bone, nasal bones, and also some bones are pneumatic, means they are having air inside. Why does it happen that some bones have air inside, and what for is that? It has the huge biological meaning. First of all, the empty bones inside, they ease the weight of skull, thus making our skull lighter. Means if the bones were dense completely, our skull could weigh up to 3 kilos. But right now it's about 1 kilo and something. The next, these empty portions called sinuses, they serve the places for heating or warming, humidifying and purifying of air. Number 3 function is they serve the space for tuning of our voice, means that is a resonance effect. Probably you have noticed that the voices of relatives are very similar to each other. For example, the voices of mother and daughter, or voices of sisters or brothers between each other. That is because the inheritance and genetic predisposed structure of the laryngeal folds or ligaments, plus the inherited volume and depth of these sinuses, like maxillary sinus, like frontal sinus, ethmoidal cells, and even sphenoidal sinus. Now, how these cavities appear? The reason is that 2 stages of development. Bones, they grow in a different mode. Those bones, all bones of the body, and plus the base of skull, they undergo 3 stages of development, and what is going on that they grew thanks to cartilaginous stage. So that cartilage helps to grow the bone in width, in length, and moreover, those bones who have 3 stages of development, they in majority of cases they have bone marrow inside, so they're full of stem cells that help to for bones remodeling on one hand, and for fusion or healing of the bone on the other hand. Those bones who undergo 2 stages of development, you should remember them forever. They are roof of skull, some bones of facial skull, and part of clavicle. And there's an interesting way how these bones are growing. The osteoblasts from the inside of the bone are spent to grow the bone outside. And on that space, on the remaining place, jelly-like substance or just cavity remains. If it's a substance called diploe, means we're talking about the roof of skull. So in the roof of skull, in time, there is a small space filled in with diploe between the internal plate and external plate of these bones, part of frontal bone and parietal bones, and even squama of the temporal bone. The elder is the person, the bigger is this diploe. We see that as a loose tissue or the loose portion on the X-ray film. For bones like frontal bone close to nasal root, for maxilla, when they are growing, the osteoblasts are spent to grow the bone outside, and just cavity, the empty place, remains. The elder is the person, the bigger is the sinus. So the newborn has very small maxillary sinuses and closed frontal sinus, it's missing, very small or missing cellulae of ethmoid bone, and absent sphenoid sinus. The elder the child becomes, the bigger are the sinuses. So that's about how the development or the mode of development of the skull bones is associated with the sinuses of the skull. Pneumatic bones that are having air inside, they are connected with each other. For example, here you can see a section made from the inside, and I'm showing to you just with an arrow the cells of the ethmoid bones and the frontal sinus, which will be above, and on the sides there are maxillary sinuses, and all of them are joined. They all open into the middle nasal passage called middle nasal meatus. So maxillary sinus, frontal sinus, anterior and middle cells of ethmoid bones, they open into middle nasal meatus, while the posterior ethmoidal cells and the sphenoid sinus, they open to superior nasal meatus. These things you should remember for the application, your knowledge in clinic. Skull bones are connected to each other by sutures. This is the connective tissue articulation, and they are quite different. They have specific names. The sagittally oriented is called sutura sagittalis in Latin. Then that suture between the frontal bone and 2 parietal bones, they're called coronal or sutura coronaria here. Then the occipital suture is here, and the suture between the occipital bone and 2 parietal bones form the lambda-like shape. Lambda is a Greek letter, that's why This suture is called sutura lambdoidea here. Sometimes in between the sutures, small additional bones appear. They are called ossa saturata, or completing bones. This is not pathology. This is like a variant of development, and this usually does not affect any function of the skull. So these are one more scheme of the sutures located in the skull. So frontal, coronal, squamosal between the parietal bones and temporal bones. Here are temporal, sagittal, occipital, and lambdoid. And the bone grows usually along the perpendicular these sutures. The small parts, anossified parts in between the bones, remain till birth, and they are called fontanelles. Now, one more concept we should cover in this lecture, the concept of counterforts. What is that? Counterforts are the thickening of the bony tissue, like lines, helping to redistribute the pressure while we are chewing the hard food. So, if we bite something hard or chewing something hard, our very thin facial bones can crack. We can have a fracture. To prevent this, these lines redistributing pressure, they help to do it. And these are called counterforts. So in maxilla, we have 4 counterforts. They are frontonasal. Look, I'm showing that to you. Frontonasal counterfort. Then alveolo-zygomatic means they are moving along the zygomatic bone. Then pterygopalatine, they are moving to pterygoid process from the palate. And palatine, they are redistributing from the very thin palatine bones. The mandible counterforts, they include alveolar here. They are almost vertical, coming from the teeth alveoli to the chin. And ascending, these are the lines of ascending counterforts along the branches or rami of mandible. And counterforts of internal base of skull, therefore, and they are anterior counterfort, here is that, anterior counterfort, then posterior counterfort, frontal counterfort, and occipital. Anterior counterfort, it corresponds the lesser wings of the sphenoid bone. Posterior counterforts, it corresponds the pyramid of the temporal bone. Frontal, it runs along the frontal bone from the inside, comes to the crista galli of the ethmoid bone. And occipital one, it runs along the internal surface of occipital bone, comes to internal occipital protuberance, also redistributing pressure. Now some differences of course exist while aging of the skull. Aging of the human causes the aging of the skull too. So the skull features are different in newborn, in childhood, in adult, and in elderly. In newborn, this peculiarity is the presence of fontanelles. Fontanelles are remnants or remains of the connective tissue from that membranous stage of development of the roof of skull. And there are many fontanelles like frontal or anterior fontanelle, posterior fontanelle, and 2 lateral, like sphenoid and mastoid. The fusion or disappearance of fontanelles happen in different time. The anterior fontanelle should ossify by the age of 1 year old. Posterior fontanelle usually fuses by 1 month old. Lateral fontanelles, they fuse at the first week after birth, or sometimes they even are fused already by birth. This is not happening if the baby is born preterm. More differences of the skull in childhood. The bones are more in number, of course, because some sutures are not fused yet. The sinuses are not developed, and now you understand why. Then the counterforts are not developed because the thickening of the bones, they happen only after the pressure is applied, means after the child starts to chew hard food. Then the shape, size, and parts ratio, of course, is different compared to the adult skull. There are no parietal and occipital tubers or prominences. Diploid, that is the space, is not developed, and the veins are less. In elderly, also there are evident changes. All sutures ossify, and not only sutures, but small foramina here through which some nerves are passing, some arteries should pass. They also may ossify, and that causes the worsening of blood supply to various regions, and that's why in elderly the hearing is worse, the vision also is bad. Some structures, so they change as well. Alveolar processes, they are disappearing, and the teeth are lost by elderly. The bones become more fragile because of loss of calcium in aging. The mandible shortens and becomes more protruding. Variants of development of skull includes additional bones between the sutures or ossa saturata. If they are between the occipital and sagittal sutures, that is, if it happens in lambdoid suture, it is called ink or inx bone, as it was revealed in the gravings of in Peru in inks. Also here represented different types of sutures. That is also not anomaly, but variant of development, means it does not affect the skull functions. The mystery and of special interest are Paracas skulls. There are many theories related Paracas skulls. These are the grave of around 300, about 300 remains and skeletons, and their skulls were elongated. Of course, it could be done artificially, but some scientists said that in artificially deformed skulls, the skull capacity is not changed, so the brain volume will be the same like in normal people, while in Paracas skulls the brain volume is increased by 20%. So till now the scientists argue, is it a normal person or just with artificial deformity of skull like in many religions, or are they descendants of some unknown tribes that we don't know? Some people even say they are descendants of aliens that visited the planet.